When COVID-19 vaccines became available in California, police officers, firefighters and other first responders got priority access, and potentially more. There were Airbnb gift cards, bicycles and cameras. Cash raffles ranged from $20 to $1,000. Some prison healthcare workers were made eligible for cash prizes just for sitting through a 30-minute vaccination education training. But despite the priority access and array of incentives, vaccination rates for police, fire and corrections agencies across LA and California have lagged well behind the state's average for adult residents, according to a survey of agencies conducted by The Times. While about 72% of adult Californians and 64% of Los Angeles residents 16 and older have received at least one vaccine dose, only about 51% of city firefighters and 52% of LAPD officers are at least partially vaccinated. Fewer than 30% of El County Sheriff's Department staff have received vaccine doses through employee clinics. Some could have received shots elsewhere, but the department doesn't keep track. About 54% of employees of state prisons are at least partially vaccinated, but rates plummet at certain facilities, with one site recording just 24% of staff fully vaccinated. The low rates, which are not fully understood due to a lack of universal tracking, mar an otherwise positive outlook as the pandemic wanes and the state reopens. As first responders interact regularly with the public, the fact that many remain unvaccinated is a growing source of tension among city officials, public safety leaders and their rank-and-file workforces. The debate centers around a troubling question: are unvaccinated public safety members a threat to public safety? Law enforcement analysts, activists and ethicists acknowledge that, for the most part, public safety workers should be entitled to make independent decisions about their health. But they also say the reluctance to get vaccinated against COVID-19 is a matter of public concern because of the jobs such workers do, which require them to work in close spaces, such as jails and courthouses, and interact with some of the state's most vulnerable residents. Some officials are increasingly eyeing vaccine mandates as agency vaccination rates plateau, incentive programs fall short, and the moral implications of an unvaccinated workforce come more sharply into focus. As first responders, that's a significant public health issue. It isn't only a matter of their health, but others they come into contact with daily, said Miami Police Chief Art Acevedo, who heads the influential Major Cities Chiefs Assn. This is becoming a big discussion among the chiefs and health leaders. We often interact with people who are high risk or maybe can't get vaccinated because they have cancer or have immune system problems, said Arthur Caplan, founding director of the Division of Medical Ethics at New York University's Grossman School of Medicine.